and good evening. This is our live event, once again, IVF webinar, as it is 8 p.m. UK time. Please let me know that you can hear me. And well, Mandy, hi, how are you? Hope you can hear me.
Yes, I can. Finding you, Caroline.
Excellent. Thank you so much for confirming that. And please let us know that you can hear us both, as we would like to go ahead and make sure that all is working. And well, simple as always, I just want to remind you that we are gathering here today so that you can ask your questions, but also meet top fertility experts, but also get some support during those uncertain times. I know some of the clinics are already reopening, so fingers crossed all will be good very, very soon. But we know still some of you cannot. So we are just simply here to help you out as much as we can. And of course, all those events has been brought to you thanks to our ambassadors and partners. And I just want to mention that tonight we have a very special guest and actually our ambassador with us as well. And it is, of course, Mandy Rodrigues, and she's a clinical psychologist, registers with the Health Professionals Council of South Africa. And Mandy today will be talking about the impact on infertility on your relationship. So she is here to start off with her presentation on that topic. But also right after this, she will answer all of your questions or comments. So feel free to type those questions in the chat section so that Mandy can help you out. I'm sure she can. So I can only encourage you to use this option and ask as many questions as you need. And well, Mandy, I believe that is it from me at this point. Are you ready to begin?
I'm ready to start. Yes.
Excellent. Thank you so much.
So, thank you very much. I find I'm a psychologist, so I find all these virtual meetings pretty weird because I usually read everyone's body language and know where I'm going right or wrong. So this is something that we all having to get familiar with. I'm talking tonight on the impact of infertility on your relationship. We know that infertility has an impact on all our relationships, including our relationship with our family, with our friends, work colleagues, the church, whatever it might be. And I love this picture. I only found later a picture that was very similar where the couple are actually holding the baby shoes together. And I'm hoping that through my talk, we can actually see that this is what we're aiming for. So I attended a live webinar by Dr. Alice Domar and Elizabeth Grohl recently. And they spoke about the emotional roller coaster of infertility, which we all understand and we all know that we go through every month. And there's this constant grief cycle that we go through every month when we get a negative result. But for me, the first slide that they presented was pretty alarming, which I'll go through after I show you a couple of the videos that I'm going to. It was on patients before they even embarked on an invasive fertility journey. So it was on couples prior to starting IVF or IUI, and that slide was quite alarming. What I've done in the next slide is just a patient's voice, because I think the best way we can understand what we're all going through is to hear it from a patient's voice in terms of this infertility journey. And I'd like us just to go to the video, which is 50 seconds long, and listen to what she has to say.
Months of hope, excitement, doubt, and then disappointment. And it's incredibly hard to pick myself up again.
Okay, I think that video has maybe stopped.
Okay, sorry, just let me try again then, okay?
No problem.
Months of hope, excitement, doubt, and then disappointment. and it's incredibly hard to pick myself up again.
Okay, I'm afraid that this is...
Okay, no problem about that video.
Okay,
What she was basically
apologies.
talking about is the beginning of her roller coaster of infertility, of finding that there's this constant hope and expectation only for it to be dashed at the end of the month. And she goes through how hard it is every time she goes through the cycle to get back on that roller coaster and present again and look for that energy and that courage to continue. So to go back to that first slide that I was mentioning, what they found in this original study was that 40% of new patients presenting to an infertility clinic had a psychiatric disorder diagnosed. And this was before any treatment started. And this was making them vulnerable to what they had to go ahead and possibly compromising their cycles going forward. It showed how important it is to manage couples psychologically during treatment and not to exclude the men, which was very important. Another study that they quoted was once in treatment is how 57% of men and 30% of women, sorry, other way around, were presenting with a clinical diagnosis of depression. And 76% of women and 2/3 of the men presenting with anxiety. Now, these are properly diagnosed psychiatric disorders. And the problem is we know if we combine the two together, we are at risk for a major depressive disorder. And we know that that then has an impact if we look at stress and the impact on fertility treatment. There's been tons of studies on post-traumatic stress disorder and the fact that once we go through treatment and we start trying to conceive, that there is this almost traumatizing reaction to anything that resembles the trauma of infertility. So whether it be a pregnant woman, a pregnancy announcement, anything like that. And these studies have been going for a while, showing that couples even need to be debriefed after possibly they fall pregnant. So I'd like to ask you that question. I want you to think about, up until this point, how has your relationship been coping? Another study I found is that 1/3 of patients had a psychiatric diagnosis before they started treatment. Now, these patients were not patients who had been in invasive treatments before, but had kind of accepted there was infertility and decided to go forward. And we've got to ask what came first. And I would like to think that it's one of two things. Either their stress was not well managed, which we'll get into now, which put them at risk possibly for infertility, or the journey that they had gone through thus far made 1/3 of them actually present with psychiatric diagnosis. And either of these ways, and for any of the studies that I've previously quoted before, it just shows how important a multidisciplinary team approach is in terms of infertility. So I attended ESHRI 2019 in Geneva this year. I loved this picture about that renowned poem by Stevie Smith that says, "I'm not waving but drowning." And I think for me, that conceptualizes a lot of what the patients are going through. And they had a patient session where they had someone called Jessica Hepburn, who's been through numerous losses and numerous unsuccessful treatments, and came back to speak to the audience to say, how did she make sense of this and how did she cope? And I think most important message I got from her was that doctors and the medical fraternity need to understand that they are leaving at the very least a scar and sometimes an open wound. And she did bring up that psychological support should continue even once the patients were pregnant. And we know that research now shows that there's a huge detriment to women who are pregnant and the impact on their babies, the impact of the males born to women who are stressed, who have possibly compromised sperm problems. So this psychological support needs to start before, but then continue, like she said, after you get the double line. Now, we often talk about the one stage of infertility, which is the grief cycle we all go through. But over the years, so I've been practicing for about 26 years in the field. I am a proud IVF warrior. I'm wearing a t-shirt of a support group I belong to in South Africa, which supports couples called Hannah, You're Not Alone, couples all over Africa, and especially couples who possibly cannot afford treatments and are coming to terms with the acceptance of infertility. They're trying also to stigmatize or destigmatize infertility. And I've noticed with couples, there's originally, while they're still trying, before they present for treatment, there's this big surprise. I've been trying all my life not to fall pregnant, and suddenly I'm not using condoms and I'm ready to fall pregnant and I'm off my contraception, and suddenly this is not happening. So at the very beginning, there's still this belief, whether it be false or not, that there is some semblance of control over their infertility. Then couples are still together and they spring into this action phase. So they start scrutinizing their behaviors. Maybe they change their diets, their eating. They try and do everything right, monitor their cycles. And then when it's not working, they start getting irritated. And this is where I call fertility triggers start emerging, where well-intentioned advice is met with irritation. Then they go through a stage of anger where there's a lot of guilt and shame. And this often emerges within the marriage. And then there's some sort of acceptance, and they're ready to now go into the next stage of, well, what do we actually do? Now, we are in this fully together, and I'm going to show you a picture now of research that shows at the very beginning of fertility treatment, we're in this together as a couple. We believe if we do everything, we can get it right. We're not ready to look beyond the next step. And then this disillusionment starts setting in. And like I said, blame, guilt, and a big thing is a sense of helplessness and lack of control. And now we've just gone through this first cycle and we start emerging into the second cycle, which is a more chronic cycle. Now, Kubler-Ross cycle of grief, kind of you can adjust it to infertility and say, month by month, we're going through the cycle of a negative result or not falling pregnant, and then we go through the shock, belief, denial, can't believe this is happening, numbing, and then we bargain where we try and make sense of everything, and then we go through a bit of anger. I remember going through my fertility journey where I would get upset with the staff, and then I would blame myself, and then there would be this realistic anger where there's no one to blame. It is something that has happened, and the helplessness would begin, and depression, and then the acceptance, and unfortunately, maybe fortunately, the cycle would happen again. But the Kubler-Ross cycle of loss and grief is nice, and it is, as you can see on the screen, it is organized, it is structured, but the reality of what we're going through is unfortunately not like that. It is more like the blue diagram over there, where it's up and down, and we go through the one emotion, and then the next, and then the next, and it's all jumbled. I want to play you this next video so that you can listen to what we have to say here.
So you know your husband goes through challenges with this journey as well.
You see how he avoids talking about fertility or hearing the news of a friend's wife being pregnant, and he finds it challenging to follow a healthy lifestyle when his friends have babies and still drink and smoke. And as a husband, you definitely know your wife is going through a hard time because you see it every day. If we look at that, it has an impact on both of you. Your marriage, your social life, your financial stability, and your intimacy. You both start avoiding social events because you feel you don't fit in. You both have to compromise financially, and your intimacy is a big problem, and maybe both of you don't address this elephant. So we can only but see this as a couple problem. It doesn't matter the reasons for your infertility. The consequences of your infertility are a couple problem. And recent research at ESHRI looking at marriage show a positive relationship exists between a positive partnership and pregnancy outcome. So that leads me to my next slide, where I'll ask you this question again. How is your relationship coping? And I love this picture. I have it behind me in my study. It is, you can see there's a tiny, that's a car with a little person standing next to it to show the size of the sculpture, where it's two adult human beings who are being stubborn, but inside are these two children who are vulnerable and trying so hard to reach out to one another, but they don't know how to. Now let's have a look at the risk in marriage and what does this do to our relationship. If we look at a man's day, there's a lovely book written, which is written quite humorously, called Why Men Don't Listen and Women Can't Read Maps. And it was written by two psychiatrists who picked up that men and women communicate very differently, and this was proven scientifically. So when we're communicating about something as intense as infertility, we're going to have this wide range of means of communicating. I love this slide where I'm sure it looks familiar to all you couples, where your husband says to you, but I never said that. And your wife has got a folder and tons of files and drawers that she goes back and says, but remember, and she's got all these memories. This is pretty normal amongst couples. They do tend to communicate differently. So how does it impact on infertility? It's not the infertility per se, and I often say that, especially to my couples entering infertility or entering a invasive fertility clinic, saying that it is not the IVF per se that is going to cause a divorce. And being in practice for 26, 27 years, I've never seen a couple where it is the IVF or the infertility that has caused the problem. It is the way you as a couple manage this journey that causes the risk in the marriage. So again, men, as you found, are often more optimistic. Okay, they're often the ones who are easy to brush it off to protect you and to kind of say, this is going to happen. Don't worry about it. There is the next month. They're more concerned about the wife that possibly they married, that they've lost in some way. Whereas women are more concerned about this month to month, and they actually want someone to listen to them. They know that their husbands can't fix this. And, you know, I often marvel when I'm looking at the next step with patients and what do we do next? And do we consider donor eggs? Do we consider IVF, IUI? It's often men, when they hit that crossroads and they've got to make that decision, they make the decision. Women want to know the end of the road before they've even started the journey. So there's often this dissonance in how they cope with it. And what happens is the males don't want to upset their wives. So they tend to avoid this elephant in the room. How many of you men, if there's any of you listening, actually fear telling your wives that someone is pregnant, or worry about what they're going to get home to when they get home at night because a wife might be struggling again? And so they work longer hours, they maybe don't bring up the subject, and what their wives do is start coping independently, and so do the men. And it's this independent coping that we worry about, because this isolates people even more. So, in a study done looking across changes in relationships across a 5-year period, this was done in couples who didn't conceive a baby. And there were couples doing IVF. And they found in the first year, both parties were as a team. They attended all the scans, they looked at all the research together, they chose the fertility specialist, they attended all the visits, and that was their first year. As the second and third year came along, they kind of coped a little bit better purely because it was more predictable, the process. But the wives would say, you don't need to come to scans, don't worry about aspiration, I'm fine with this. But they would start to get disillusioned about the process. And it was in year 4 to 5 that this independent coping started happening, where the wives were too scared to share with their husbands what was going on, because their husbands might just say, well, you know what, I married you to be with you, so I want you back, let's stop this. And the men were too scared to bring up how they were feeling because they didn't want to create any sense of conflict. And that is where they found that the risk in the marriage occurred. So it was not the IVF per se, but it was the way the couples were managing it. And that's a phenomenon we call independent coping. So I just want you to listen to a patient talking as well about how she coped independently with her husband. If we can play the video.
I eventually didn't want to go anywhere, see anyone, take any calls, reply to any messages or emails. I have my own bakery and I didn't even want to take any orders. It started to affect everything in my life, from my business to my relationships with my friends to my relationships with my family. It affected my marriage in many ways, as it took my frustration out on my hubby. And it affected our intimacy, which, when trying to conceive, is the most important thing. It became a chore. It became a chore because I really didn't want to do it, but not because I didn't want to be with my husband, but because at the end of every month it brought me so much pain.
So intimacy, we know, is a big factor that occurs amongst couples, and for different reasons for both parties. Then this guilt in infertility starts emerging as to whose fault it is. Now, there's shame and there's guilt, and shame often impacts on our relationship with ourselves, and it impacts, if we look at this slide, shame is internalized and it creates self-doubt, low levels of self-esteem and inability to share, ashamed perhaps culturally of what we're going through. And guilt is about feeling bad and blaming yourself or possibly somebody else, often emerging in conflict. And we found this is one of the factors that also created a problem, was if I feel embarrassed myself, how does that impact on my relationship with other people? And if it's my husband's fault, or even if it's my fault, what does the guilt do to me? Now, if we look at guilt, why do we all feel guilty? You know, guilt is seductive in one way. We feel if we can convince ourselves that we're responsible for something, then we can fix it. But unfortunately, with infertility, other than doing what we're doing, there is very little control once we've done all of that. These kind of statements were statements that women who felt guilty came up with. Things like, I feel everything that went wrong in my life was somehow my own fault. I can't get pregnant because I wanted too much. I'm being punished. I feel guilty about a previous abortion, and this is why it's not happening. What if he or she leaves me, or our lives have changed? And the men would often say, I don't feel like coming home to the sameness of infertility. So how do we educate ourselves and implement some action? So I often say the first thing is, let's learn about your diagnosis and learn about the process that you're going to go forward with. I did my first IVF 26 years ago, and I remember back then I would put all my medication in an envelope day to day and have times, because it made me feel I had some control over some of the process that I could go through, that I could take my meds at a certain time. I made it predictable so that I would understand where are the difficult days, where am I going to battle, what days are difficult, and then rather taking action than actually letting this powerlessness take control. Just for the last video that shows the difference between guilt and blame, if we can play that one.
Guilt and shame are challenges we go through with all the infertility cycles. If we look at the difference between guilt and shame, shame is when we feel maybe embarrassed, we don't share, we feel we've done something wrong, it impacts our self-esteem. Guilt has the same repercussions on ourselves, but it involves another person. Guilt can be exceptionally destructive on ourselves and on relationships. When guilt is justifiable, you do something wrong, you feel guilty and remorseful, you apologize, and then you change that behavior. But in infertility, and even if you did lead an unhealthy lifestyle or took steroids, you have felt guilty about it, you have felt remorse, and you have changed that behavior. So that is when guilt should end.
Okay. I love this picture of, could be a man and wife, it could be two people in a building, both are feeling lonely and they can't reach out to one another. And these are two quotes by women that I found. We are not alone. When I shared the experience, I saw that we had kept all the pain to ourselves. When we don't function as a man or woman culturally, there is a sense of failure, unfound shame about our bodies, and we don't share this. Another woman went on to say, 1 in 4 women has had a miscarriage, but we don't know this and it is not spoken about. And sometimes we don't want others to feel embarrassed or uncomfortable. It's the same, I know in Africa we have 1 out of 6 couples are infertile. And we're trying very hard with all the support groups like House of Fertility, IFASA, Honey, You're Not Alone, to actually destigmatize infertility so that we share it more. Because if 1 in 6 of us are going through it, then it's far more than what we're hearing about. Another tip of advice is, whether it be a therapist or whether it be with your husband or with a friend, sometimes we've got to address that elephant in the room. Now, I know men are reluctant to actually go for therapy a lot of the time, And I love these two cartoon clips saying, the first one, I think once he begins to see the benefit of couple therapy, I'll be able to loosen some of the ropes. And the other one of the parties saying, so whose side are you on? And I just think if couples understood that there is ways we can help you from the beginning, almost like marital counseling, from the beginning through to the end, we wouldn't have this disjointedness that we do in relationships. And I often say, especially to the men and to the family supporting infertile people, be silent when it is time to listen. And I love this other quote where it says, the rabbit says, I'm afraid, to the bear. And he says, what are you afraid of? And the rabbit says, I don't know, I'm just afraid. And the bear says, then I will sit with you until you're not afraid anymore. We will face it together. That is all your wife is looking for, or all the person you're trying to support is looking for, is just someone to sit with them. It is not someone to fix it. Just again, attend scans, men. If you look at this picture, what we go through when we go through the scan, women, you can all relate to this. You know, ask your husbands. Your husband might say, we are not going to, I don't need to go with you to a scan. Or you might say, I don't want to impose on you. But just ask him. Maybe he wants to. Maybe even after a year, maybe that's when you're going to need the support. And finally, just one slide before the last one, is that action phase is good, because only good can come from that phase right at the beginning where we're all eating healthy and looking at our stress and doing lifestyle changes. And remember, eating healthy can also increase your time to pregnancy, as can a good relationship. Most importantly, I want to stress to you is chronically or managing your chronic stress. If you can manage your chronic stress, and you don't need to do that with a therapist, you can go online and you can manage this. It actually reduces your stress to a point where a study shows that the pregnancy rates go up from years ago where it was 30% per IVF to 67 or higher percent of success rates. So the website is there that you can go back, and it is things that can empower you to do something possibly together. Again, that's just saying also getting support from family and friends. If you do go to my website, I do have a brochure that is downloadable in terms of what to tell family and friends and how they can possibly help you. And also, the emotions of guilt and shame and blame do more harm than good. Finally, this is where I want to get you. Not waving, but drowning. Okay, you are drowning going through this journey, and you feel like you're drowning. But I need you to know, even though you are drowning, you can appear okay, and your life can still continue okay. We can get you to cope alongside your IVF or your fertility treatment, so that the struggle is not just about the drowning. The struggle is about learning to live alongside that. Thank you very much, and I look forward to your Q&A and your questions, and I hope I can answer them.
Excellent, Mandy. Thank you so much for that presentation with lots of details, very important ones, and take-home messages were on point for sure. Well, there are lots of patients that are struggling with it, lots of relationships. So thank you so much for also being with us tonight and sharing your experience as well. And yes, now it is time for our questions. I'm still waiting because someone is typing, so I guess everyone was definitely listening to you, and they didn't provide the questions yet, but I'm sure there will be some. So let's give it a minute. I do see someone is typing, so I definitely want to. Okay, it's not actually a question. However, as I've mentioned, that must have been useful, as here's the comment, in fact. Not a question, but thank you. Very helpful talk.
Oh, thank you very much. I appreciate that. You know, I think it's something we don't talk about often, and I think it's something we need to with our husbands too. And even though they might be reluctant to come and seek help in some way, it's seeking help to help you as well. So, and to help understand how you're coping with the journey, which will help them cope better with the journey. So I
Exactly.
hope, you know, I hope there was some useful
There were definitely
take-home
useful
messages.
tips, that's for sure. Thank you so much. Well, there is a question in the meantime, so I just want you to have a look at it. So, how many couples end up getting divorced after repeated failed IVF and miscarriage? Based on your experience, anything you can add?
You know what? If I look at statistics, I can't give you statistics. If I look at my experience over 27 years, there are not a lot of couples who end up getting divorced due to miscarriage or to repeat failed IVF, but it is how they cope with it afterwards. It is, you know, and I guess it also depends on whether they are successful in the long run or not, because it is often the failed IVF and the willingness of one partner to go then to the next step that creates the marriage problem. It is dealing with the miscarriage differently that creates the marriage problem. So I think definitely, I always say, and I say in the clinics I work for, when there is a failed IVF or a miscarriage, the couple is immediately given an IVF session, a psychological session where we can debrief them and say, okay, what do we do as a couple now? What is our next step going forward? What is our next step in terms of the miscarriage? And you know what? At the end of the day, in my heart, I'm saying, if someone is going to leave you because of repeated failed IVFs or miscarriages, then, Eloise, I'm not sure if they would have hung around with a postnatal depression or with challenges that happen once you've got a child. So I definitely think it's something we can avert by following up when there is something like a negative IVF or a miscarriage, and have a look at, okay, what is the next step? What do we do as a couple? And I think that's what's important.
Excellent. Thank you so much. That is definitely encouraging. And well, in the meantime, there another question is also right here. Huge thank you for your question. And here's the one. How would you go about helping a couple who are on different pages? For instance, wife would like to continue treatment and husband doesn't want to.
Okay. So, like I've said before, the husbands tend to, you know, I see husbands initially before they embark on any treatments, and they'll often say, I am not having a baby via IUI or AI. I am not doing IVF. I am not doing any of this invasive treatment. And down the line, they do it all. Men are more by nature optimistic. Okay, they tend to say, when the next step happens, then I'll address it. So what I tend to do is say, let's get on the same page. Let me, as your therapist, go through the different stages of, if the next step doesn't work, what is the next step? Let's see how you both feel about it. you might come to terms with it sooner than your husband, but you need to also ask your husband, what is it that he's worried about? And I can promise you the largest percentage of husbands are worried about what continuing treatment is going to do to their wives. Not as much, yes, there's the cost, but they're more worried to know their wives are going to be okay and they're not going to feel supported. And I sometimes get the wives to write down their fertility triggers. I've in fact got a card game, and we get the wives to take out the cards that are familiar to them and the husbands to take out the cards that are familiar to them. And then we almost do a snap and we say, okay, the two of you feel the same there. The two of you feel the same there. This is possibly how you can manage it. This is how your wife feels. This is how you don't. And we start bringing that in. So definitely we can get you on the same page.
All right, perfect. Thank you so much for that advice and your question. And definitely useful tips for sure. And well, there's another question coming up right here. Don't you feel very interesting indeed? The briefing should be part of every single treatment session, whether it's had a positive or negative outcome.
Absolutely. I actually do, because first of all, the negative outcome, we know what the person's going to go through. We also know that there's certain studies who say it's not about the finances. A lot of people say, in our country, we have to pay for our IVFs. In certain countries, they will give 6 free. People come for 1. And why is that? It's not because of the finances, it's because of what it does to them and what it does to possibly their marriage. If we debrief someone after a negative outcome, they're more likely to come back and they're more likely in the end to have a positive result, specifically if we include the husbands. The second thing is, when there's a positive treatment, when you've been going through infertility, there is suddenly this lack of naivety, lack of enjoyment. There is this possible anticlimax. You've been waiting for the double line, now you get it. And now it's kind of, now what? Now there's anxiety for the 6-week scan, and there's anxiety for the 10-week scan. And we know that chronic stress during pregnancy needs to be managed because it has a lot of income. So yes, I feel it should be for both. I really do.
Excellent. Thank you so much. Yes, that might be actually a good option, and actually just make the patients, feel more encouraged, as you've mentioned. Yeah, definitely.
Yes.
Thank you so much for that. Okay, next one is here. According to the stages, what do you recommend to move toward acceptance?
Okay, so acceptance in terms of accepting your next cycle, Maria, or accepting that you're done with infertility. So if we look at the very beginning, to move towards acceptance, and in fact, you're saying with the diagnosis. So when we're having a look at that, I often sit down with my patients and I say, okay, what is the worst case scenario? What are we sitting at here? This is your diagnosis. These are your options. I look at it like a test tube. So people think, so there's 2 test tubes. In the one is the sadness about the fact that because of your diagnosis, it's not going to happen like you think it's going to happen. People think I've got to deal with that sadness, and then possibly my excitement will slowly build up for the next stage. No, the way to go towards acceptance is to have that long-term goal in mind and say, let's start preparing you for the worst case scenario, and let's see that the excitement slowly grows as the sadness gets less. So that's how I do it. I start trying to create a peace of mind about the next step forward and have a plan in mind. And at the same time, look at your goals and look at saying, okay, what is the next step in terms of let's get other goals in place. And I know that's hard, and I know nobody wants to hear relax and it'll happen. Nobody wants to hear any of that. But if we can get other goals that there are to fall back on that run concurrently to your fertility goals, to that worst case scenario, people cope better. And I wrote a chapter, I think it was 3 years ago, for a textbook in Europe on why do people who adopt fall pregnant? And it was a similar thing. They had accepted their worst case scenario and they were working towards that. And in between the adoption or before they got there, they fell pregnant because it was something else they were focused on. It's not something you can do yourself. It's not something I can say to you, just relax and it'll happen. But there are techniques we can get you to focus on, a plan for a year of your fertility goals and a plan of your other goals, and merge the two together.
All right,
I hope
perfect.
that helps, Maria.
Yes, as you can see, Maria has just would like to thank you for that and for explaining and for your advice. Well, definitely something that it's hard to do, but what you are saying definitely I believe means a lot to all of our patients. So still waiting, someone is typing, so let's give it a minute. Just want to encourage everyone, if you would like to share anything, have any comments or question, just go ahead and type it in. Mandy will be happy to help you out, I am sure. So don't miss your chance.
And I think it's important to say I've been there. I tried 3 in vitros. And none of them worked. I had 2 early miscarriages. But you know what? I went on to have my children with assistance, but I went on in between, and it always happened while I was saving up for the next IVF. And I had other things that I was doing, and I couldn't wait for my cycle to start in the April. And it would happen before. Obviously, because my mind wasn't on it at that particular stage, I never thought it was possible naturally. But for a lot of you, I know if there's no tubes or if there is no sperm, it's not possible to have that hope in between. But yeah, so we'll see the next question.
Of course, thank you so much for sharing that as well with us. And yes, there is another question. How do you help couples if one partner is more comfortable with the prospect of egg donation and the other isn't?
Okay, so this is a big one, and I can promise you it takes me 2 sessions maximum, maybe a session, but let's say 2 sessions to get them on the same page. I inform them with literature. I look at the various options. I say, okay, so what is our options? Our options are donor gamete. Our options are adoption. Our option is no children. And I look at the values associated with those. And then we start looking at what are you actually afraid of? And I've typed a list over the years of things people are afraid of. And I give each couple the list and I say, go home, read this independently, start doing a bit of research for me, and come back to me. And I promise you the majority by the next session have come back to me and they've addressed those issues by themselves, and we're left with the issues that they haven't. So we do get them on the same page. Because there is always one, and it's often the woman who can't even say the word egg donation. And the men don't want to agree to it because they don't want to feel like they're betraying their wives in some way. So yes, I would have a look at, and I've got literature, I have a look at what are your various options. Let's pursue one of those. Let's pursue the option of egg donation. You don't need to put any money down. You can look at the agencies, you can look at what's available, and if you are not ready, you will very quickly close down those sites. And the next time it'll be a little bit easier. And the next time, and slowly those tubes, as the sadness gets less, the tube for excitement gets a bit more.
Excellent. Thank you so much. That definitely sounds encouraging indeed. And anyone should be actually thinking that way, just you have mentioned. It's not easy to do, but one step at a time, right?
Yes,
Excellent. Thank you so much. And as you can see, there is one question here. How do you manage the other stress of financial aspect on top of infertility stress?
I know. It's such a big thing, and I know specifically here in South Africa, other than one medical aid that pays once a year, ours is not covered by the health system. So the majority of the people, unfortunately, in our country cannot even afford to have a look at that option. You know what? I often say to people, okay, we've got to say, what would a holiday cost us? What would a year of education cost us? Look at the statistics and say, I am willing to put aside, if the stats are 2 out of 3 should work at my age, to try and put that aside and to have that goal aside so that they can manage it. It is a very difficult one, and we're busy personally with the fast, so we're trying to put this message across that medical aids should recognize, like the World Health Organization, that infertility is a disease, because the financial aspect is a big one on top of the fertility stress, unfortunately.
Okay, thank you again for answering this question. And there are more of those right here as well. So what is the impact of social pressure on the couple that is trying?
Well, yeah, like I said at the beginning, there's this tons of feeling you don't fit in anyway. So there could be cultural pressure. There could be this pressure from friends. There could be extended family pressure. And a pressure that we often ignore is that the woman possibly hates her job to death. But because of what Donna said earlier, she is trying very hard to actually keep her job in case she falls pregnant, to get the maternity leave. But unfortunately, we feel marginalized in all those categories. And sometimes it isolates us from sharing. Karaba, and it's so good to see that you attended the talk. Karaba Zwane is the wonderful founder with her husband, Pastor Jerry Zwane of Hannah, You're Not Alone. And yes, they do look at especially the cultural pressure of the couple that is trying, and it is a huge aspect of what people are feeling. They don't belong anywhere, and they feel marginalized in every aspect of every area of their lives.
Perfect. Thank you so much once again for that question, as well as your advice on that. Okay, next question is here. Struggling to decide on the same treatment between us, what would you recommend?
Well, I would say, you know what? Rule of thumb is go to a fertility specialist that you trust, okay? And trust what he's saying. I guess it's also hard because a lot of the time with infertility, you kind of have a choice. You know, I've also had cancer before, and there I didn't have a choice. It was, you go in, you have the mastectomy, you have your chemo, and this is what you do, and you got a 95% success rate. IVF, I found worse, I must be honest, because a lot of it was about, first of all, medical aid didn't pay. Secondly, it was a struggle between what is the, with IVF, well, am I ready to start now? What are the finances? What are the implications for work? So when people are struggling, I strongly recommend that they get together and possibly go and speak to someone if possible and say, what are our options? And why possibly does your husband not want to do with this? Or why don't you want to do this? And usually it's because I don't know how she will cope. And we need to bring that out and say, your wife is not going to have a nervous breakdown. She's going to cry. She's going to need you. They're often worried about how they're going to support you through this journey. And I think we need to then say there's these different treatments, but let's have a look specifically if it's IVF, maybe as a very expensive investigative procedure. And then you can both decide, you know what, embryo's formed, so we know that we have the peace of mind, we can continue naturally or with timed ovulation, etc. Or we know, hang on, there's a problem here, so we actually have to go forward and we got to do something else. So I think, again, speaking to someone in the know, even if it's a fertility sister that's available at a clinic.
Oh, great. Perfect. Thank you so much once again for your advice on that. Now we will go to possibly our last question, but if anyone has any other questions, this is your final call for them. So go ahead and type those in. We will be slowly finishing. But here's the question. How did you overcome the loss of your 2 miscarriages? What practical advice can you give to grieve the loss?
So, Eloise, in a way, I was fortunate. For myself, look, I deal a lot with stillbirth and I deal a lot with babies in the NICU dying. So mine were early miscarriages, meaning they were both blighted ovums that were established pretty early on at the 6-week scan. But regardless of that, it's still a miscarriage and a loss. You need to understand when you have a miscarriage, even a negative IVF result, because that's a baby, you grieve into the future. So all significant anniversaries, as soon as you find out you're pregnant, you're grieving into the future. You're thinking, I would have been 3 months then. I would have had my baby by Christmas. I would have had it by Easter. So to understand, you go through that same grief cycle I spoke about in terms of the Kubler-Ross cycle of grief, of bargaining and understanding, and allowing yourself to go through all those stages. The complication with grief and miscarriage and loss is when you don't allow yourself, I'm not saying the luxury, but I'm saying the actual opportunity to allow yourself to go through those stages, because then you can get a complicated grief cycle and it can all come back later. So my practical advice is the first 2 weeks are usually the worst, and then the next 4 weeks a little bit easier, 6 weeks of acute loss, and then it settles into some sort of acceptance. But again, that's when people get assistance. And that's why I always say it's important, go to the right people. And if you can't afford a therapist, go to people like House of Fertility, Empty Wombs, Hannah, You're Not Alone, My IVF Answers, those kinds of groups where online you're going to get professionals speaking.
All right, thank you once again for that. In the meantime, one more showed up, okay, in 3 parts. So I will just simply show you. I am struggling to believe that I deserve to be with my partner. I have constant fear to that he might want to find someone else. What is your advice? What your advice would be?
Look, you know what? I'm not quite sure what is going on, if it's an egg or sperm problem or what is happening. I need you to also understand that Yes, there's some exceptions to the rule, but the majority of the men I have seen, I say 98% of the men I have seen, they often say to me, I married my wife to be with my wife. Okay, so I get that he's 5 years younger than you. I married my wife to be with my wife, not to have kids. Women are more likely to get married to the kind of partner, and it's shown in biology, that they want to have kids with. Often the men will choose, give me my wife back and we can establish some sort of life together. The women are the ones that fear that insecurity most of all. And my advice would be, look, you're 39, he's 5 years younger than you two. I don't know what your FSH is or what your AMH is, your egg reserve, but he can still have his own baby with you carrying it. And if your AMH is a problem, if your FSH is a problem. And always remember that even if you feel it's your responsibility, it's a couple problem. At the end of the day, I have seen so many people who might have an egg problem, and 2 years down the line, they meet someone else for whatever reason and they fall pregnant. So it's not to say it's just one partner, it's the two together. And I suggest you talk about it to someone, because that is, you're feeling ashamed and you're feeling guilty. And shame and guilt brings you nothing but depression and internalizes and makes you more insecure. Whereas if we can have you realizing this is a reality, let's have a plan in mind. Are you willing to be on board? Why aren't you? What are your different options? And I can tell you, he would be willing to be on board. It's his sperm. And getting him over donor eggs and informing him about donor eggs can take 1 to 2 sessions. And it does make sense in that cognitive mind of the men I see.
Perfect. Thank you so much for that advice. And well, as you can see, there is a thank you from our patient as well. Thank you for that. And well, someone is typing, so I just want to make sure that we have. Oh, yeah. Sorry, there is a question already right here. Is it possible to be genetically mismatched with someone with which such results in fertility?
You know what? I am not a fertility specialist, so I'm a clinical psychologist who specializes in infertility. I think that is pretty rare. Obviously, we know if siblings or closer are trying to have babies, that, you know, there's those kind of problems, but very different. I wouldn't, from the bottom of my heart, I must be honest, I cannot answer that. I know that it does happen, but I know that it is also quite rare. And I'm the wrong person to ask. I'm sorry, Louise.
Okay, that's perfect. So thank you so much. Of course, as you can see, there are some thank yous, and I guess we will be slowly finishing. If you have any question left, just go ahead and type it in. And when I just said that, there is another one right here. Let me just show you. So my husband wanted to wait a few years in between having children. Now I'm 42 and are needing an egg donor. I'm feeling angry and resentful. Any ideas on working through those feelings?
You know what? The anger and resentful, I can understand. He wanted to wait a few years, so I can imagine that there is some feeling of blame towards him, possibly. The problem is, it is what it is at this point. Feeling guilty about it or feeling angry or resentful is not going to fix it. What needs to fix it is some action now. And yes, my ideas on working through those feelings is I think you need to explore the next step of using an egg donor. It is less daunting as one looks at the research a little bit more, including the research on epigenetics. I know it is a very sad place to be because you're grieving the loss of your own DNA. But if you look at the field of epigenetics, your own DNA does have something to play in the outcome of the baby. If it's in terms of feeling angry and resentful towards your husband, I think the two of you should go and see someone and sort that out and come up with what is the next step. Have a plan in mind, because anger and resentful is not going to get us anywhere. We can still be angry and resentful, but let's have a plan in mind in terms of what are we going to do about it. And Kate, I hope that helps you, but I do think that we need to actually do some more research on it and get that sadness less, get that excitement more about the next step, and look at what the other option is: childless, adoption. I'm not sure where you live, so it could be surrogacy, etc. And have a look at what are the options that I would then take. Which of these options are we willing to approach?
Perfect.
Because either way, even if you meet someone else, you're going to need an egg donor. So walking out on your husband would not be an option. If you know what I'm saying, it's not going to help your fertility.
Perfect. As you can see, Kate has already thanked you. It does help. Thank you so much. Thank you, Mandy, for those words again. I mean, everyone, as you can see, are writing already some thank yous for your explanation, for providing all those tips. And I cannot agree more with our patients. Well, I guess we will be finishing for tonight. But Mandy, huge thank you for joining us tonight, for your support. I just want to mention that, of course, Mandy is also our ambassador, has been supporting our Stronger Together initiative from the very beginning. So huge thanks for this. And well, I can only just show you more of those. Thank you, Mandy. Very informative session. Such great explanation. Thank you. This was a very interesting session. And one more. Thanks very much. Very useful. Anything you would like to add?
Thank you very much. I really appreciate it. And thank you for listening.
Excellent.
Thank you, Caroline.
Thank you as well. And well, I just want to mention that, of course, this is it for today. But of course, we will be back here tomorrow at 6 p.m. UK time and at 8 p.m. UK time. So I hope you will be able to join us as well. There are more topics to discuss for tonight. Mandy, thanks so much. And well, just want to add that you can subscribe to our YouTube channel, and that way you will be up to date with all of our uploaded events. And well, one more thing, I see that Mandy has disappeared, but of course, let me say, okay, I think she is reconnecting, so let's wait. Hi. We lost you for a minute, but you're back. Yes. Okay, good. So I just wanted to thank you, Mandy, once again for a very interesting, very important session. And I agree totally, as you have mentioned, we don't speak enough about that. So thank you so much for joining us. And well, I just want to add that if anyone would like to get in touch with Mandy and just get some support and be contacted with her, all you need to do is also click on this link I have just sent to you. That way there is an option to ask your question, and this will be sent to Mandy. I'm sure 100% that she will be able to help you out.
Yes, thank you. I know that I've got 2 requests. So for those listening, those requests will be answered shortly. I was just preparing for a webinar I did yesterday and for today. So emails will be answered tomorrow or Wednesday. I promise.
Excellent. Excellent. Thank you so much once again, Mandy. It has been a great pleasure to have you here with us tonight. Thanks so much. Have a lovely evening. And, well, everyone, take care, stay safe. And I do hope to see you tomorrow as well. Thank you. Bye.
Thank you, Caroline. Bye.